Yeah, so thank you so much for joining Castory and John Method. I'm so much happy to have you here. I know you're very busy, but yeah, you have got some time to talk. And for me, the first time when I saw about Dawalink, I was actually one of the people who were counting down for its release. It was something that really excited me, and I was really looking forward to when I see these kind of initiatives, especially from pharmacists, from people who many people think they cannot code. I get so much happy, and I know that we are getting somewhere. So I saw it, and I was so much excited. Then I said, I think something like this should be known to people. Like we have to make some noise about it. We have to make some awareness to people to know that there is something like this that exists. There are so many solutions out there which people do not know about them. So yeah, that's why I invited you and thank you for accepting my invitation. So I have this session called Career Talk where I just talk to different people from different careers. And I think it's a high time right now. We should be talking to pharmacists as well, especially when they are doing some remarkable things, such as something which you have just done. So I'll first of all I'll give you time to introduce yourself so that everyone who is watching will know like who is Castorian, who is John Method, and then from there we'll start to talk about Dawalink and generally about digital technology in health sector, especially in pharmacy sector. So you're welcome. I don't know who is going to start. Anyone can start.
Yeah, I think I will start. So my name is Castory Munishi. I am a co-founder of PharmX uh, Solutions Limited. And PharmX Solutions Limited is a company that is focusing on building technologies, digital applicational technologies for healthcare. And one of both programs is the Dawalink application, which we just launched a few days ago. And I'm also a co-founder of that. And I'm very happy to join you and talk about one of our first products. There are many which are coming, but today we can focus on Dawalink. Yeah. Over to John, our leader.
Thank you very much, Josephat. My name is John Method. I'm also a pharmacist. I graduated from Wimbledon University. I believe we all did. And also, I'm a co-founder of PharmX and Dawalink. As the story said, is that we are a tech company that really wants to help the players in the pharmaceutical market to do their operations smoothly. So right now, I am leading the initiative of Dawalink. I'm the team lead, and I'm really happy to be here and share the good news with everyone that is interested to know about this. Thank you very much.
Thank you so much. Let's get straight to business. What is Dawalink and why Dawalink?
Thank you. I'll go. So Dawalink is a marketplace for pharmaceuticals, and it's a digital market for pharmaceuticals that brings together the sellers and buyers, just like any other marketplace where the buyers and sellers come together and meet and do business. So Dawalink is the same thing, but it's digital. So it's a digital space where suppliers of pharmaceutical and retail pharmacy owners, ADOs and hospitals, they are meeting together and see what products the supplier has at what prices, and then if they agree, they make the business and the delivery is done. So that is Dawalink, and we've been working on this for some time. And as you saw, we just launched a new version of the app, which is being used by the retail pharmacy owners. And the other side of the coin, the suppliers are using their website. So the suppliers are listing them, the retail pharmacies, by using the Dawalink application. They can see those products and they can make an order when they are ready to do that. And the other part why Dawalink is that the pharmaceutical supply chain is very complicated, as you know. The products are coming from Europe, they're coming from India, manufactured there, and then the importers are bringing in those products in the country, and then the wholesalers are taking them from importers. There's a lot of wholesalers in between. So these products, they exchange hands, and then they go to the retail pharmacy owners, and then they go to the patients. So this process is usually coming with a lot of problems attached to it, including inefficiencies, high prices, and sometimes the essential medicines are not really available to the people that need them. So Dawalink is here to streamline this process and link these two entities, the retail pharmacy owners and suppliers together, and make sure that when the products are needed, are obtained at the right time, right quantity, and they're delivered to the corresponding entity without wasting more time.
Okay, thank you so much. Then I was so much interested to know, like, there is something we call a pain point. So, what is the pain point? What is actually something that the main problem which Dawalink is actually solving? And if I can get more explanations on what is the current situation and what is Dawalink actually going to work it out.
Yeah, so the main pain point of the pharmaceutical supply chain is the inefficiency in the whole process. So there's a problem of availability. You need products, but then you don't get them from the suppliers that you know. There is also the problem of deliveries. You find products today and then you get them after a few days' time when you've already missed a lot of customers and things like that. And also the other thing is the pricing issue. So as these products are moving from one entity to another, they usually add profit margin on top of them. So if a product was imported at maybe 1,000 units of price, you find the retail pharmacy owner receives those products at maybe double the price or triple the price. So that is the problem that these retail pharmacy owner are facing. And Dawalink now, as the marketplace, is removing all these bottlenecks that are attached to the pharmaceutical supply chain. So you just have your application, you log into it, you see the suppliers listed and their products, you make an order, and then their products comes to you right away without wasting time at a standard price that you can afford.
Yeah, maybe if I can add, there's also a big waste of data, like the supply chain data is being wasted. If people that go to buy physically, there are no records, they don't know what they bought last month, they don't know what they bought 2 years ago. But with a platform like Darling, there's a lot of data that is generated, and the users can see the orders they've made for the past 1 year, for the past 2 years, for the past month, so they can improve their operation. So that's one of the big issues that's coming with Dawalink, and also they can get to know over time what kind of products are moving in their pharmacies. Yeah. So I think apart on top of inefficiencies, but also we need to bring in a component of data which will even increase the efficiency and the productivity, but also reduce waste of pharmaceutical products and waste of data.
Yeah, and also I think the other important thing is the issue of counterfeit medicines. That is one of the biggest challenges that is facing the pharmaceutical supply chain in many African countries. We have fake medicines, we have expired medicines circulating in the market. So with platforms like Dawalink, we could be able to trace these products from the point they enter the country until they reach the final consumer. So I think this could be also good news to the regulators, the TMDA, the Pharmacy Council, to see how they can incorporate digital solutions like Dawalink in their routine inspections and see how they can assist to reduce the problem of counterfeit medicines in the country.
Okay, thank you so much. So I've got a very good point, realizing that it's not only about making the process of acquiring medicines easy, but also just having to help people to understand how they can use their data to manage their business. How do you assess the knowledge and understanding of people in terms of the importance of using data? Because many people, as we know, like many of us, we operate locally. Most of the times we just make phone calls, and I don't think if so many people bother to do so much of data analysis to analyze their businesses. So that's one point. I just want you to give me your understanding and also your experience when you are doing the market research in terms of how people value the importance of doing data analysis. That's one. Second, how tech savvy these people are. There is always a challenge of embracing technology, new technology thing, because most of the times there is that resistance, like this is a new thing. I'm used to my words and everything is just fine. How are we going to make people embrace this the technology?
I think the issue of market research to see how the personnel in these retail drug outlets how do they value data and how they can use it to make decisions. First, when we were starting, we did the research in 2018. Actually, we partnered with a consultancy called Apotheca, and we did a market research with around those 300 pharmacies around Dar es Salaam. And the results were actually very interesting, in that most people were really valuing the of data, and they know how important digital tools could be. But also from our personal experience, I think myself, I'm a pharmacist, so I've been to different pharmacies, and I see there's different levels of stock keeping methods, ranging from paper, Excel to point of sale system that are already in the market. And I see the shift that most pharmacies are now, are shifting from paper-based record keeping to digital solutions like point of sale and things like that. But also question about how tech savvy they are. I think that's not a big issue right now, because social media have completely changed the narrative. People know how to use Instagram. They can use WhatsApp. They use X and similar platforms, which if you take a look, they have a similar make, and the user interface is usually the same. And also most people have, gone further and tried, online purchasing systems like Amazon, like things like that. So using Dawalink, an application that helps them to make online purchases of medicine, I think it's not something very new. And one of the things that we do right now is that we train our salespeople when they are going around to recruit retail pharmacy owners and others and hospital pharmacies. They try to, have a conversation instead of just going there, hey man, just register.
And maybe I can also add, thanks, John, for very good responses. I think John is right on point. And I like that he touched the fact that we started this journey a long time ago. So I think the environment is changing. Actually, when we started in 2017, this journey, we were ahead of time. That's why our startup or our idea did not materialize. Then up to 2022 is when things started to kick off. And now coming to 2025, the awareness is very high. People are more open to platforms. They've interacted with other platforms that came after us. And currently now when we are launching Dawalink, we find that the feedback is much better. People are now used to these systems. They're aware, they're very excited. But the thing about data use, yes, they have some basics, and that comes with experience. Like, yeah, like I was selling a lot of paracetamol last month, so I think paracetamol. Someone in Manyara can just take on their phone, they can go online, look at the available drugs, and then they can order, and then we deliver. So in the next 5 years, we want to first spread across the country with the Dawalik platform. So I think that's the main aim and the main realistic. We want people to be aware. We want everyone to be using the platform, but also we want everyone to have an account that they can go back and see what they bought in 2025. It will be 2030. So we want people to see, okay, in 2025, I bought this, I bought this, I bought that. Is my business going forward? Is my business going back? Those kind of metrics. We want people to have those kind of data in the next 5 years. But also, it should not only be in Dar es Salaam, all over the country. Yeah.
John, do you
John,
have
maybe if you
add?
can,
Yeah. I think the story is right. The main goal is to make sure that each and everyone of the retail pharmacy owners in the country have access to Dawalink, which can then assist them to do the purchasing of their medicines and assist them to grow their businesses. But also maybe to add is the issue of incorporating other features and technologies. It's not only about selling online. There is also right now, if you've been watching the news, you'll understand that there's a lot of things happening in the world, especially the artificial intelligence, machine learning, and things like that. So having digital tool like Dawalink, you can actually plug on these technologies and see how they can further assist the issues of predictions. If you know how much you spent on medicines this month, you can actually predict on how much you can spend next year and things like that. So I think in terms of growth, region-wise, but also in terms of expanding the level of features and technologies that are available in Dawalink versus the pharmacy owners.
Thank you so much for that. And now that maybe this should be my last question for today. How much do you think of digital technology as a solution to most of the problems we have in Tanzania? Do we think that we need digital technologies in most of our things, especially in healthcare? Or at what point do we draw the line?
Yeah, maybe I can start. That's a tricky one. I wouldn't say that we need a digital solution in everything, but I think it depends on the nature of the problem. It's something like supply chain, you can easily digitalize. And then something like patient care, like a doctor meeting a patient face to face, that's something else. You don't need to digitalize maybe today or tomorrow. So that being said, we don't need our digital solutions on everything, but for some of the things, I think, especially operational, business operation, everything, anything that is operational, that is not human interaction, I think their digital solutions will add in efficiency. I've lived abroad in some of the developed countries, like in Norway, where they have almost everything digitalized. They don't even have physical cash, and things are working. They know everything. They have good data. Like you can go to hospital X, and then you can pick up your prescription in any of the pharmacies in town. So why not digitalize? So you just go to a doctor, you visit them, they tell you you have this and this. After you finish your consultation, they give you a prescription, and then you can go out wherever pharmacy you want. You can go, they have your information and they pick it. How is that possible? Because of digitalization. So it depends. We cannot digitalize everything, that's completely true, but there are some things, especially operational issues, especially things that are related to logistics. Those ones need to be digitalized for sure. And that's why we're creating Dawalink. And that's why we won't stop at Dawalink. We want to also reach the patients. But that's a topic for another day.
Yeah.
John.
Yeah, nice story. On my opinion, I think that's also that's a tricky one. But the main thing is to understand what is the role of digital tools in especially in healthcare systems, because it's not only about meeting giving the medicines or the services to the patient. There's also that ethical issues involved. So I think before we embrace digital tools, there is also a need to understand how they work, what are the challenges with them, and to prepare the environment to lie them before we jump to conclusions that they're not good at all. But generally, I think these are tools that they are at our disposal for us to use, and how they work, how they perform, that upon the one who is holding that end of the tool. So I think they're very good if they're used very well, and also if there are regulations in place that can assist, can help the regulators and the government to monitor how everyone is performing. So if everyone is using digital platforms without having clear rules, clear limits, that could be a problem. But if there is good environment laid for everyone to work, I think that they can be very game changing, especially in the healthcare systems.
Thank you so much. So, who is your competitor?
Yeah, so our competitors, I think we have people that we call competitors, but just because they are operating online. So we just lump them into competitors. We do have a few other companies that are working online. So yeah, but then we don't really consider them as competitors, because right now the digital tools are just entering Tanzania, and I think we need everyone to put their hands on the wheel, to steer the wheel, to make sure that we move in the right direction. So I think it's not more of the competitors, but more of the people who are doing the same thing, and we're very happy to work with them and learn from each other. And actually they help us to, if a competitor, as you said, is launching another digital tool in the healthcare system, they can actually assist us to penetrate even more when we launch our platform. So I think they're more of collaborators in this context than competitors, as I said. But of course, there are a few other companies that are working on idea of digital solutions in the healthcare.
Okay, okay. So Castory, what do you want to tell pharmacists? I believe pharmacists and all pharmaceutical personnel in general are going to be maybe your main clients because most of them they are supervising these pharmaceutical outlets, community ones, but also some of them are business owners. So what do you want to tell them? I don't know. What should they expect from you?
Yeah, Dawalink is the main point I'd like to tell them, like, Dawalink is made with love by pharmacists for pharmacists, but everyone can use it. But yeah, so we are used to use platforms that have been developed by IT companies only, and those which are composed of IT people. But this is something that is being developed in collaboration with ITS, but it entirely it's the thinking and the design of pharmacists. John is like the our UI and UX designer.
Wow.
So very interesting. I manage the repos and then my IT. So this is something that is internal. It's made with love. We understand what pharmacists need, what people in healthcare need. We have that context inside. So we welcome them. We are building things for them, so we expect them to use, and we are very happy to take feedback, and we love our customers. So welcome, support us, download the app, use it, make an order. If there's anything goes wrong, call us. We are very available. Anytime you can call us, we can be there for you to help. Yeah. So this is just the beginning, and it's going to be more fun.
I'm looking forward to that, definitely. Yeah. Do you thank you so much for the responses to all the questions. Maybe if there is anything else you would like to share to anyone who is watching.
Yeah, John can give closing remarks, I believe. John?
Thank you, Castory, for believing in me. So basically, just like Castory said, there's one point I want to insist is that Dawalink is being created by pharmacists. That is a very good, very important point. So usually, if you take a look in the market, we have a lot of platforms, especially in the inventory management systems. We have them from India, we have them from other countries. But none of them are made in the country and made by pharmacists. So, for example, if you take a look at some of the platforms, they can manage pharmacies, but also manage other businesses like groceries, supermarkets, and stuff. And of course, we all pharmacists, we understand these medicines are a special kind of goods. You cannot treat them as food, I mean, as rice or clothes. There are rules and regulations attached to them, but also in case there's a mistake or any error, you're risking the patient's health. So it's very important that the pharmacists are taking a lead in this. They are developing something which is going to be used by pharmacists, and they understand the issues around the pharmaceutical sector. So we took the first step. We're in the market. We are building this ourselves. So one thing that you can do for us is to hop on the journey and do something like testing, try the platform, make a few orders, see how it works. And if it doesn't work, please call us, send a message. We can always improve it in the next versions. So that's very important for us. And I believe, we are not building this for us. We are doing this for the customers in the market. So please, give the comments, share the feedback. That's very much appreciated.
Yeah, and John, maybe I can add, I think our main happiness or our main joy in this mission is to see people using the app to make order to improve their operations. That's the
Yeah.
main thing we are looking for. We just want to get dopamine when we see people are making orders, the orders are getting delivered. That's the dopamine we are looking for. So
Yeah.
I think people who went in med school, they understand that.
Yeah,
Yeah.
sure. Yeah, that was so powerful. Thank you so much, guys, for joining. And I wish you best of luck. We as pharmacists, we are here closely looking at what is happening. Don't let us down, right? Don't let us down. Yeah.
Will not.
Yeah, I would like to wish you a very nice Easter. Best of luck.
Thank you.
We'll come across at some point somewhere, I believe, for those who are in Tanzania or even somewhere else. Yeah.
Yeah,
Yeah.
I think we'll see you on our next launch in the next few months. Something else is
Yeah.
coming
Yeah,
up. So
please let me
maybe,
know. Yeah, let me know.
yeah.
I would be happy to be there. Yes.
Okay. Thank you.
All right, Paul.
Thank you very much.
Thank you so much.